Okay, so thank you everyone for being here today. And so the background on this practicum is that during the COVID-19 pandemic, health workers around the world have faced unprecedented levels of risk that are significantly higher than the risks one typically signs up to have as a health worker. Health workers are not soldiers. Health workers are not typically in the line of fire. But COVID-19 made everyone vulnerable, particularly frontline health workers. And this situation, it not only created new risks, but it also exacerbated situations that already existed, other pre-existing challenges within the health system, such as late payments, low salaries, insufficient infrastructure, insufficient resources to care for patients. So anything that was already happening in health systems was made worse by the pandemic. And so this complex situation launched a new wave of health worker protests around the world. So this was originally launched by the Accountability Research Center in May 2020 at the beginning of the pandemic, as they noticed that the amount of protests were increasing as the pandemic went on, and that there were a lot of accountability challenges and failures occurring around the world. And so the Accountability Research Center is an action incubator project working out of American University in Washington, D.C., and the rationale behind launching this project was to learn from the international diversity of health worker protests, as well as to shed light on the accountability failures in public health and governance systems. In addition, the project looked to highlight health worker proposals for how to improve public health systems and to help make health workers' voices heard. And so this was done through the Health Worker Protest Project via crowdsourcing of health worker protest media reports from around the world that were recorded via Twitter, email, and Google Alerts in order to compile these media reports to get a bigger picture of what was going on. Summaries of all of the reports were shared on the Twitter account, Health Worker Pro. And within the first year of the pandemic, the project received and shared over 841 media reports on health worker protests and proposals from 96 countries. And so this is the geographic distribution of these reports. So as you can see, reports were received from truly every region of the world. And so this is a closer look at the geographic distribution of these reports. The majority of reports were received from the United States, 169, 78 from India, 65 from Mexico, 29 from Nigeria, and many other reports from other countries, but in smaller numbers. And it's important to note that this does not necessarily speak to the distribution of all protests. It speaks more to the distribution of the media reports. So in looking at this, we can see obviously protests that happened in English-speaking countries may be more likely to be picked up by the media. The United States also has many different media outlets. And when you look at the demographics of the Accountability Research Center's network, mainly English speakers, Spanish speakers, which may have contributed to the high number of reports received in English and Spanish compared to other languages. So this speaks more to the media reports than the protests themselves, but is still a very interesting distribution. And so I worked with this project beginning in May 2020. I helped launch the Health Worker Protest Project and worked in the compilation and sharing of all reports. And for my field practicum in summer 2021, I was supposed to go abroad to Haiti. However, due to the pandemic, that was not possible. And luckily, I was able to continue working with this project and take it a step further to analyze these reports to learn more about the needs and demands being expressed by health workers in these protests. And so here is the main conceptual contextual framework for the research that I conducted, looking at the challenges facing health workers during COVID-19, health worker needs and demands, and how these influenced and created health worker protests, and how these protests were both caused by and were meant to put pressure on the governments or hospital administration or public health systems that were accountable or responsible for the challenges that were occurring and who had the power to provide additional support to health workers who were experiencing challenges due to the COVID-19 pandemic. In terms of the methods, so originally we had 841 reports from 96 countries, but the original call for crowdsourcing included both protests and proposals, where protests were organized protests, whether in person or via social media, and proposals were still very useful documents to receive, more of health worker complaints or suggestions, as stated in media reports, but that did not result in an organized protest. So for the analysis, we had an inclusion criteria of the fact that it was an organized protest, whether it was in person or via social media. And we did see a rise in social media protests during the pandemic simply due to COVID-19 social distancing measures, making organizing in person a little more difficult. The protests had to have occurred between March 11th, 2020 to March 10th, 2021. So looking and analyzing just the first year of the pandemic, as unfortunately the pandemic has continued and health workers are still protesting, but we wanted to have a sort of a finite look at what happened during the first year. And in terms of our needs of analysis, we could only include text-based media reports, not reports that were only videos or only photos that didn't have textual accompanying information. And so once we applied the inclusion criteria, this is the final geographic distribution of protests that I analyzed through my practicum. So from 841 media reports on both health worker protests and proposals from 96 countries, those that fit the inclusion criteria to be analyzed included 397 media reports from 35 countries. And you can see the distribution here on the map. So again, covering almost every region, but in a smaller number than the original raw crowdsourcing number. And so for the analysis of my report, I conducted qualitative analysis using the qualitative methods of document analysis of the media reports, as well as content analysis, going deeper into the information presented in these reports, the health worker demands, the health worker quotes that were included, and looking under these main codes, the codes of resources, working conditions, compensation or job security, delivery organization or health system critique, government restrictions, social issues, and other. And so these codes were also in conjunction with another simultaneous research project that was happening with Dr. Veena Sorcha out of the University of British Columbia and Dr. Sorcha Brophy out of NYU, who were conducting a similar analysis on a different data set of health worker protests. But we worked together on the coding and coming up with the main code demands to be coded. So for the code of resources, this applied to any demands for anything that was required for health workers to deliver care safely. And one of the main demands under resources is that of personal protective equipment, or PPE, such as masks, gloves, or biosecurity equipment. And PPE became a very large issue, as we know, during the pandemic, as supplies were frequently low, health workers frequently did not have significant access, and other materials that health workers needed included training protocols, biosecurity and safety materials, data, supplies, testing of providers, as well as vaccinations. The second demand that we coded for, working conditions, were anything affecting health workers' ability to work or impacting their work environment. So this included any mentions of being overworked, understaffed, or having bad management. A major issue was that of short staffing, or since COVID-19 patients required incredibly high levels of care due to respirators, due to being unable to breathe, due to the challenges they were facing, staffing ratios became very complicated, as one nurse or one doctor could only safely care for a small number of patients. But as many health workers had COVID-19 and were out themselves, or many health systems laid off workers due to financial reasons or refused to hire additional workers, safe staffing issues, unsafe staffing was a major issue seen by health workers during the pandemic. Another issue under working conditions is that of unsafe or insufficient infrastructure. So we see a lot of hospitals that the hospital itself is not a safe working condition. Maybe there's no air conditioning. Maybe there is not enough room for social distancing, or even places for the staff to properly put on or dispose of their personal protective equipment. And then another major challenge to working conditions is that of health workers' safety in and of itself. So we saw many arrests of providers, violence towards providers, issues of security in the facility, or punishments for attacks. The third demand that we looked at was that of compensation and job security, which included any demands health workers had about their payment or employment, such as delayed or unpaid salaries, which in many cases went back even months before the COVID pandemic. Many health workers hadn't been paid, which made it even more difficult during the pandemic to pay for their safe transportation to the hospital, or even to pay for their own personal protective equipment in some instances. This also included demands for extra pay or risk allowances due to the great risks that they were facing as frontline health workers during the pandemic, demands about unemployment pay or insufficient pay or asking for benefits. Many other health workers, especially community health workers, were asking for the formalization of contracts or regularization or contract renewal, or being recognized as official government employees working within the health system. Other demands included legal protections, labor union negotiations, or dismissal or potential dismissal of health workers. Another demand that we looked at were those of delivery organizations or health system critiques, which looked at anything happening within the hospitals and health systems themselves. So whether a hospital was becoming converted to a COVID facility, whether they needed the creation of an isolation center, if they had patient overload, if the hospital was in danger of being closed or relocated, and health workers asking for greater advanced warning about their patients or inclusion in the planning process. And so the health system critique code was used for any type of health system spending, whether protests about underfunding or asking for additional funding, protests around privatization of hospitals or policies and reforms, the management of public hospitals, the poor state of health systems, asking for more resources for public hospitals. And so as these demands were similar, they were eventually combined. Another code that we looked at was that of government restrictions, which included demands of protests looking at stay-at-home orders or asking for border closure, health workers protesting around mandatory quarantine or the weakening of guidelines or restrictions, as well as health workers asking for or protesting accommodations or exemptions from restrictions, as well as the behavior of the general public. One of the last demands that we looked at was that of social issues. So any health worker protests that were carried out by health workers, but that were not necessarily specifically about healthcare or the COVID-19 pandemic, but instead other issues affecting health workers that were happening in their region or society, such as climate change, police brutality, military coups, elections, health workers asking for the release of political prisoners or kidnapping victims, or health workers protesting unjust arrests. And then lastly, one of the last categories that we had was that of other, which encapsulated concepts such as respect for or recognition of health workers for all of the work that they did during the pandemic, and especially recognition of health workers who died due to COVID-19, in many cases due to insufficient resources or support or protection from the hospital or health system. And so I went through all of our 841, later 397 media reports and coded for these demands. And this is the breakdown of each health worker protest media report demands by code. So the main demand expressed in the media reports on health worker protests is that of compensation and job security, which turned out to be a major issue for health workers. It was mentioned in 180 out of the 397 media reports, or a full 45%. And the qualitative data went deeper into many of the issues health workers faced on this front. Many health workers had already gone months without receiving their salaries even before the pandemic began. Many others were promised bonuses or pay increases or risk-related pay that never came, despite the fact that these workers were risking their lives in the front line. And this is particularly harmful in countries such as Zimbabwe or others, where health workers were already receiving a very low salary. And so on top of this low salary, they were risking their lives at work every day. They maybe had to pay for their own private transportation to the hospital because they couldn't take buses, or had to pay for their own personal protective equipment. And so low pay or not being paid on time especially impacted these health workers, but it was an issue seen by health workers around the world. And here we have a quote from one health worker in Canada: "We take the sickness to our families. We worked the overtime hours and we get nothing. We are frustrated." The second main demand expressed by health workers in these media reports was that of resources. So 164 media reports included resources as a demand, or 41%. 100 of these specifically mention personal protective equipment, so a full 25% of the reports. Many countries, almost every country, had widespread shortages of medical masks and respirators, especially in the first days of the pandemic. And while this eventually improved for many months, in some cases the whole year of the pandemic, many health workers were forced to use the same mask for extended periods of time, or reuse the mask, especially masks that had been re-sanitized using chemicals that could be potentially hazardous. And so all of this is despite the fact that the WHO recognizes that medical masks can become contaminated and can be a source of infection, and many are recommended to only be single use, or in the case of the N95s, they're recommended to only be used up to 5 times. But many health workers were using these masks for up to 5 months. Many health workers were given only one surgical mask to use for a whole week, for months at a time, despite the fact that they had to interact with dozens, if not hundreds, of COVID-19 patients. And this lack of PPE put health workers at great risk. And we have a quote here from a nurse in Peru: "We only have 3 masks to use in a month, so we have to reuse them and reuse them. So what has happened? My colleagues have become infected." The third main demand expressed by health workers in these media reports was that of working conditions, which was mentioned in 121 of the 397 protests, or 30%. And so this code includes demands such as safe staffing, as discussed, an appropriate ratio of health workers to patients, as well as the number of working hours and the number of hours on shifts. And this was made significantly more strenuous during COVID in situations where health workers could not eat, drink, or use the bathroom for hours at a time due to inability to remove their PPE. If they were to take off their protective equipment, their masks, or their aprons, their coveralls, the risk of contamination would increase. And so many health workers were in extreme physical discomfort. Here we have a quote from a registered nurse in the United States who says, "When I say I work 13 hours and I don't get a drink of water, I'm not exaggerating. And you know, I'm almost 52 years old and I'm a strong lady, but I'm not that strong anymore. It breaks my heart. The things sometimes that I see, I can leave in tears. I have left in tears." And so this speaks to the situations that workers were experiencing. And elsewhere in India, we received media reports of many health workers fainting during their shifts because they hadn't been able to remove their masks for 12 hours to even have a bite to eat or take a drink of water. Many health workers developed kidney issues or urinary tract infections due to the inability to go to the bathroom. And this is also not just due to the lack of PPE, but also due to the unsafe staffing conditions. If there weren't enough nurses or doctors to care for COVID-19 patients, or if your patient was at risk of dying and needed care 24/7, you simply could not leave. But this took great toll on the physical health of health workers and negatively impacted their working conditions. The fourth main demand reference is that of delivery organizations, as well as combined with health system critiques. And so 56 of the protests in total mentioned delivery organization or health system critiques, of which 47 protests mentioned the health system critiques and 9 protests mentioned delivery organizations. And so here we have a quote from a health worker in Mexico saying, "We demand a federal audit because we know there is equipment, but they don't deliver it. We ask for the IMSS or the National Health System to intervene." And so this speaks to many of the accountability issues faced by health workers within their national health system or their individual hospitals, where they're asking for greater support. One of the other main demands that we ended up finding in this qualitative data was that of social issues, which was mentioned by 31 protests, or 7.8% total. And the two main root causes of these social issue protests found in this data set were the Black Lives Matter protests in the United States, which was mentioned by 17 of the 31 media reports for social issues, as well as the anti-military coup movement in Myanmar, which was mentioned by 8 of the 31 media reports. And so with the Black Lives Matter protests, there was a movement among health workers in the United States called White Coats for Black Lives. And many hospitals, many individual health workers came out across the country. And one of the taglines was, "You clapped for us, we kneel for you." And so this was in solidarity with the protests around the death of George Floyd in summer 2020. And here we have a quote from a resident physician in the United States saying, "George Floyd could have been me. Being a doctor, being a hospital worker, that might not have protected me from the same fate that happened to George Floyd. I'm here as a Black man. I'm here as a frontline provider. I'm here with pain. I'm here with hurt. I'm here with anger. But when I look out at this crowd, I know I'm not here alone." So there was a lot of very powerful quotes, very powerful qualitative data on these White Coats for Black Lives protests. And then so the second main cause of the social issues, the anti-military coup movement in Myanmar, we have a quote here from a doctor in Myanmar saying, "We want to show the world that we are totally against this military dictatorship, and we want our elected government and leader back. We want to show them we will follow only our elected government, not the military," from a doctor in Myanmar. Again, one of the second, sorry, can't move this. The sixth main demand expressed in these media reports on the protests was that of government restrictions, mentioned by 15 protests, or 3.7%. And these protest demands include any health workers calling to close borders, such as the Hong Kong health worker protests calling on the local government to close the border with mainland China, as well as other protests asking governments to repeal emergency health laws or asking governments to implement a lockdown. And then lastly, but certainly not least, the smallest amount of protests mentioned other demands, 12 out of 397, but these are still very important and very powerful protests. And so these demands are those that call for health worker respect or recognition, or especially recognition of health workers who have died during the pandemic. And so there were many protests in this category that stood out. Among the others, in the United States, early in the pandemic, the National Nurses United Union held a socially distant vigil in front of the White House, where they laid out 88 pairs of empty white nurses' shoes in remembrance of nurses that had died in COVID-19. And this was a way not only to symbolize their fallen colleagues, but to engage in a socially distant protest in a time when government restrictions meant that mass rallies of people were not possible. And then in Brazil, a country that reported one of the highest numbers of nurses' deaths of any country in the pandemic, health workers held a protest standing 6 feet apart, socially distant, in their masks and white coats, holding crosses in memorial to their fallen colleagues. And so looking at all this data, how does this connect to TCD? As health workers, health systems, health is not one of the main topics typically discussed in TCD. However, the COVID-19 pandemic has been shown to be an extremely cross-cutting issue, from COVID-19's potential relationship to wildlife, zoonotic diseases, and habitat loss, as scientists try to figure out what was the initial cause of this virus and was it related to this, as well as the absolute international nature of this issue and these protests, many of which happened in TCD regions of focus and countries of focus. And so this research, this phenomenon, these protests are also cross-scale and have a cross-disciplinary relationship with many of the Sustainable Development Goals that we look at in the Masters of Sustainable Development Practice as part of the Tropical Conservation and Development Program. And so certainly there's SDG 3, good health and well-being, obviously very related, both in the health of humans with COVID-19, but the health and safety of the health system itself and the health and safety of the health workers impacted by this pandemic. There's also a large element of gender equality in that, unfortunately, as these are media reports, second-party reports, it's impossible to know exactly the genders, the amount of each gender or gender identity of the health workers protesting. However, my research suggests that nurses were incredibly vulnerable, and nurses are frequently a fairly gendered position of health workers. Many nurses happen to be female. And in addition, one of the different cadres of health workers that were greatly impacted and greatly involved in programs was that of community health workers. And in many countries, such as India, Nepal, Pakistan, community health workers can only be women. And these women are some of the most vulnerable members of the health system, those being paid the least, those with the least support, but they were the absolute backbone of the COVID-19 prevention, tracking, and treatment measures in this country, in these countries, particularly India with the ASHA workers, the accredited female health volunteers, who are being paid less than $2 a day, but were expected to go and visit dozens of families without even having been given a mask or gloves. So there's certainly some gender issues embedded in this research. Another issue that it relates to is SDG 8, or decent work and economic growth. As we've seen, compensation and job security was one of the main demands expressed by the health workers in these protest-related media reports. And so we're looking at health workers who may already have had very low salaries or asking for an appropriate pay raise in line with the risks that they are taking or the personal expenses they've had to take on to keep safe. And then lastly, SDG 16, or Peace, Justice, and Strong Institutions, looking at some of the accountability issues and accountability failures that happened in this situation, with health workers calling for justice for themselves, for their fallen colleagues, looking for stronger health systems, more accountable health systems that are more equipped to handle pandemics and more equipped to better support health workers in the future. And so from all of this research, its cross-cutting themes, the main conclusions that I have drawn from the qualitative research is that of the main demands of health worker protests around the world are compensation and job security, followed by resources, including personal protective equipment, and then working conditions. And my recommendations, which are those voiced in the qualitative data from the health workers themselves and stemming from the results of the qualitative analysis, calls to increase the production of personal protective equipment, or PPE, and increase access to PPE for health workers around the world. And then also to improve policy in order to improve compensation for health workers, especially in terms of the risks that they face during the pandemic. Another recommendation is to encourage governments, health systems, and employers to work on improving working conditions for health workers and support via policy changes. And then as well as to pay attention to and respect the intersectional identities of health workers and the social issues that affect them, which is something we greatly saw in the demand code of social issues in this research. And then lastly, one of the main recommendations, main takeaways to come out of this research is the need to give health workers a greater voice in policy and governance in order to directly express their needs, demands, and proposals in order to strengthen the health system and to empower health workers to better care for themselves and their patients. And we have a quote here from a nurse in the United States. Having a nurse who works with COVID-19 patients participate in the hospital's infectious disease task force would create transparency. You can have administrators at the top making decisions, but it doesn't always translate to changes in the real world of nursing. Just wanted to say thank you so much to my advisor, Dr. Sarah McCune, my committee member, Dr. Richard Telg, as well as the Accountability Research Center, which hosted my practicum, obviously the MVP program, Glenn and Andy, the TCD program for encouragement and support, and for everyone who supported and participated in this project. And lastly, thank you so much to all of you here today for coming and listening to this presentation. And so lastly, I would like to open the floor to any questions.